Brent, hi.
Hi, Dr. Carter.
Bill
How you
Carter.
doing?
So nice to meet you.
Nice to meet you.
So you're here to get filled up a little bit?
I sure am.
Now show us what's a concern for you.
Well-
Here, just take the mirror and point out what's on your mind.
I think it's mainly in this area, right here.
Okay.
I'd like to get filled in a little bit.
Okay.
What do you think?
I think that would be a good look for you. I
Great.
do. I think you'd be very happy.
Excellent.
Have you had filler before?
No, this will be the first time.
No, what I'm planning on using with you, Brent, is called Juvederm Ultra Plus. It's a very soft filler, and it usually lasts about 8 to 10 months.
Okay.
Depending on the person, and maybe a little longer, a little less. Look at that. Now you've had the numbing cream on for about a half an hour,
Yep.
and that's even longer than we usually use it, so you should be nice and comfortable. You'll still feel the needle stick a little bit, and turn your head toward me a little bit, Brent. There we go. As you know, there's a slight risk of bruising. How are you doing?
Fine.
Good. Now there's numbing lidocaine in the filler itself, so the injection itself is not bad. Now I'm going to give you some homework to do. I want you to put a little pressure there with your left
Sure.
hand. Thank you. And then we'll come around to this other side. Now, with your particular pattern of facial lining, and we had talked earlier about Brent's concerns, so he's not completely naive to this discussion. We had talked about your nasolabial folds and these creases on the sides of your chin tended to make a kind of circle
Correct.
configuration. We're trying to break that up. How are you doing?
Great.
Good. Okay. Yeah, it doesn't look like that looks the bruise, which is nice. So I think I'm just going to now smile for me. Okay, and then relax. Do you like your dimples when you smile on the sides of your mouth or not?
You'd have to ask my wife that one.
Oh, all right. She hasn't made a comment?
No.
Okay. All right. I'm going to soften them just a tiny bit then,
Okay.
keeping with our goal of breaking up the circle. And it's gonna break down fastest right there because that's where there's the most motion when you smile. Now, Brent, this is an intradermal injection. It's a very soft filler. And after we put this in, then I'm going to mold it a little bit so there aren't any areas that are too full.
Okay.
Now smile again, Brent. Okay. Your dimple isn't quite as deep over here. Now you can relax. When we fill nasolabial folds, we're right under the crease to just a little bit right underneath the crease or medial and inferior to the crease. How's it going, Brad?
Excellent.
Good. We're trying for a nice natural contour here. Okay, Brent, let's see where we are here. Good. Now, all I want to do now, Brent, is to smooth this out a little bit. Sometimes that'll stir up a little extra bleeding.
Okay.
Open your mouth there a little for me. Good. Okay. Just a second. Now, a little pressure right at that spot for me again. And thank you there, sir.
Mhm.
Let's move this. A lot of people tell me this molding process is the most uncomfortable part of the whole thing.
Actually, not bad.
Oh, good. Let's just make sure we don't have any high spots. Okay. Now, a little pressure up there too, and we'll wait just another minute, and we'll be all set, and we'll get a look at the finished product.
All right.
Now, let me show you the mirror, and you'll see how those depressions are softened.
Oh yeah, that's great.
Isn't that interesting?
Wow, that's amazing.